Good day, S4OM community. Welcome to Conversations with the Oncology Care Team, a webinar series sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. Our goal is to provide information to help massage therapists and estheticians support their growth as practitioners with enhanced knowledge of current oncology care options. My name is Erica Clinton, and I will serve as the moderator for our dialogue today with Darrell Cousino. Darrell is the Market Director for Spiritual Health Services for Bon Secours Mercy Health in Toledo, Ohio. In this role, he has a strategic oversight for spiritual health in 7 Toledo Market hospitals, their physician enterprise, and Mercy College of Ohio. He is a board-certified healthcare chaplain since 2014 and started his chaplaincy career in outpatient oncology at St. Anne Hospital in Toledo. Currently, he is in the process of becoming an ACPE certified educator, leading units of clinical pastoral education. Thank you, Darrell, for taking the time to join us today.
Yeah, thank you. If it's a lot of letters.
It is, but the more letters, the better.
Yeah, right.
And clearly, you are a very qualified person in the area that you work in. And that's one of the reasons why we're really excited to talk to you today, so that our community can learn a bit more about what you do, about spirituality and healthcare, and just how we can all be a better collective group of practitioners when we're working with cancer patients. So I'd like to get us started by just helping our practitioners understand your work. So can you start off with an explanation of your role in patient care as a chaplain?
So chaplains, we're part of the clinical team. Our specialty, you might say, is spirituality, spiritual health. And in Bon Secours Mercy Health, particularly, we're part of a Catholic health system, and so faith-based, we're very well integrated and I think really well respected as members of the team. We work with patients and their families in terms of what's going on with them spiritually and emotionally, and how are they making meaning related to their illness. Part of what we do is assess spiritual distress. It's important. Spirituality is this sometimes vague thing. People aren't always clear exactly what we're talking about. And for me, it's helpful to talk about it in terms of connection. And so, if you have a person who is, body, we have these physical bodies, that the nurses and the doctors are attending to medically and so forth. And we have these minds, this cognition, and these brains that, that education and learning and so on. And we have this emotional self that had, all of our feelings and so forth. Spirituality is that thing that connects all of that integrates it all. And so if you think of like a Venn diagram, of body and feelings and mind, and then spirituality as this whole circle around that. And so focusing on the whole person and attending to those things in terms of connection. And so how is a person experiencing connection related to themselves, feeling comfortable in their own skin, feeling okay with themselves, feeling like they are themselves, how are people experiencing connection, related to others? So community, maybe a religious community, your family, spouse, possibly children, etc. And then how are people experiencing connection, related to the more, call it God, call it universe, higher power. And so as we think about those things and think about a person who's experiencing illness, the chaplain comes in and begins to try to assess, where's the disconnection happening? And then how can we provide some interventions that might help to rebuild some connection and build some meaning around what's going on with them? Maybe they're experiencing grief related to their illness, loss of certain bodily function or freedom or something. And so that we can begin to address those things and help people to work through those parts of the experience of illness, and how then they can work towards healing and wholeness, even if they're not working necessarily towards cure or not able to get to cure. How do they go through that journey in a way that is holistic and healing, generative, even, in an integrated way?
So that's amazing because I just realized that what you do is a lot like what massage therapists do
Mhm,
when we work with cancer patients,
mhm.
right? Like our goal is really to help them integrate that body, mind, and spirit in the best way possible as they're navigating some kind of significant healthcare challenge or physical challenge. And for many of them, it becomes a real spiritual challenge, but that the body work somehow helps them feel, as you said, part of something, maybe return something that has been lost to them in their journey through illness, and really provides a supportive kind of scaffolding for whatever they're dealing with. So
Mhm.
that was really a nice learning moment for me because I was like, oh, we have a lot in common
Yeah, yeah, I
with
think we do.
chaplains.
Mhm.
So let's give our listeners a little idea of how or what's the path to becoming a chaplain. What does that look like from an education, study, self journey perspective?
Mhm. Yeah, so historically, I mean, chaplaincy arose out of, Christian faith primarily, this blend of Christian pastors working in hospital settings. And so discovering some of the psychological skills. Antonin Boysen, I think, was one of the first back in the 1920s to develop this process for clinical pastoral education, where recognizing that spiritual leaders bring a certain something into that clinical setting that is important, but also need to grow and develop their sense of like the human person and various behavioral sciences and so forth. So the path for chaplain education is really this blend of spirituality and psychology, which my undergraduate degree is in psychology, and I have a Master of Divinity, and so I've always seen this kind of holistic piece of this thing, both of those disciplines talking about the same thing but using different language. And so a chaplain's typically, are beginning from that viewpoint. Oftentimes, they've maybe been pastors in a church previously. And again, this is the in generalities, and historically, this is kind of how chaplaincy emerged. And more recently, chaplains are coming from all different kinds of faiths and backgrounds and educational levels. In order to be a board certified chaplain, a chaplain needs to have a master's level education. They need to have 4 units of clinical pastoral education, which is this process of being in, a hospital setting, a clinical setting of some kind. And they are doing the functions of a chaplain and then reflecting with an educator and with a group of peers who are doing the same process, writing verbatims, talking about an encounter that they had that was maybe particularly difficult, or there was something poignant that happened, or they just want to reflect more deeply on it, get feedback from their peers and from their educator and talk about who they were as a person in that encounter, what they assessed with the patient, what kind of interventions they offered, what those outcomes were, and then how might they have done that, differently, or what did they maybe miss, or how were they possibly hooked emotionally by what was going on. And so it's this rich process of really exploring oneself as a person and as a minister, as a caregiver, and then also learning some clinical skills. I mean, active listening, the sense of presence, some different ways of assessing or just asking, kind of guided questions for patients and so on. So I feel like maybe I'm rambling.
No, no,
Yeah.
this is really good because I feel like it's like, oh, this is kind of how this comes together, this background
Mhm.
in
Mhm.
divinity, but as well as the whole psychology, which makes sense, particularly because the patient interaction aspect of it is so critical to the work that you do. But it struck me that obviously chaplaincy comes out of a Christian based faith process, but obviously in a hospital setting, you encounter people of all different faith
Mhm.
backgrounds.
Mhm.
So, how does the chaplain navigate that aspect of trying to work with a person, but again, where the faith base is different?
Mhm. Well, and I think it's important to point out, that historically the chaplaincy has risen out of this, out of Christian circles primarily, but today it is not exclusively Christian. And in fact, there's a lot of effort with the Association of Professional Chaplains and the ACPE, the standard for CPE education and so forth, to really broaden that understanding around spirituality, that it isn't necessarily about a specific religion. And again, chaplains can be from any religious background. I mean, I even know, in fact, one atheist chaplain. He identifies himself as a humanist. He says, I don't believe in God, but I believe in you. And he bases his care in his sense of values and kind of what, the human person again, and these humanist perspectives, and is able to do this kind of work. And so while historically it rose from, primarily Christian clergy, it is really not that anymore. And really core to being a chaplain, very much different than being a religious leader in like a specific faith community, is that the chaplain is there to serve people who have all variety of belief, non-belief, value systems, meaning-making systems, orienting systems. And what we do is we enter into that, and again, through curious questions, kind of non-judgmental, presence with people, really seek to explore what gives their life meaning. How do they make meaning of what's going on, and how do we facilitate that with them? It's really powerful work. I was a parish pastor for about 18 years before I came in to chaplaincy, and the wonderful experience. I really enjoyed that work, but primarily working with people who believe and understand life very similar to the way that I do. And coming into chaplaincy really helped me to open up to the variety and the diversity within our human experience, and to learn a lot of things from a lot of different kinds of people. One of the things when working with our students that I've tried to emphasize with them is that, oftentimes as like that clergy person in that religious community, we are the expert in the room. Everybody's looking to us to kind of tell them what to do or to clarify truth, et cetera. In chaplaincy, it's that patient who's the expert in the room. And so we come in to listen and to hear and to work with them where they're at, and to just walk alongside of them and to provide what is helpful for them again, and that in working through it all, right? Whatever it might be.
No, that's wonderful. And I'm still being struck by the atheist chaplain. I'm like, oh,
Yeah. He's anyway, he's wonderful. Yeah.
no. So as a chaplain, what do you find to be the most challenging part about working in healthcare?
Well, I mean, so you're working with people oftentimes when it might actually be like the very worst day of their life, right? I work in a level 1 trauma center, and so we get the worst of the worst that can happen to people, or that we can do to each other, comes to our hospital. I think back in my days of working in oncology, and I think about the folks that when they got that diagnosis, and how devastating that can be when you get that news that time is limited. We're going to do what we can to bring the best quality and keep you free from pain, et cetera. But, and I've heard doctors say it, it's, you need to consider getting your affairs in order. That kind of conversation can be very difficult. And so to enter into that space with people, and as the chaplain to do that kind of over and over and over again, when I was rounding in the outpatient infusion center, it's from kind of one cubicle to the next, and each person has their own story of grief and struggle and various degrees of illness and so on. And so working with that day after day can get kind of heavy if the chaplain isn't very intentional about their own self-care and sense of community, and recognizing that, while this is going on here for this person today, that there are also, for example, so in the trauma center, for example, all these things happen, right? And tens of thousands of other people today had a perfectly fine day. Nothing happened to them. And just to remind ourselves that this work is very intense, and it's a small piece of kind of what's going on all across the city today. So yeah, for myself personally, just leaning into my own spiritual practices, daily meditation, prayer, and just kind of mindful breathing in those stressful moments, and all those kinds of things. Yeah, very important to do.
Yes. Yes, tremendously important that we who do so much to take care of others, take care of ourselves. And I know that I appreciate my non-oncology massage days as much as I do the work when I'm working with patients in any kind of critical care. It's just that I get to have that space where I can just appreciate a good day.
Mhm.
as they come. So challenging moments a lot, but what do you find is the most rewarding part for you in working in healthcare?
So I'm reminded of a woman that I worked with years ago. She had terminal cancer. I don't remember exactly what it was, but visiting with her every few weeks when she would come for her infusions, and had a lot of conversations. She was a person of faith and a lot of God talk, a lot of prayer. Very very kind of deep in her Baptist understanding, and enjoyed talking with her and encouraging her and her sister at times as well. And she had a son who lived far away. And I remember when she was admitted to the hospital near the end, and I went to see her. She was there in the bed, and she was having some pain, a lot of pain actually, and she was just kind of laying there, and she had her arms out, and she was holding the bed rails, and she was kind of crying out, as we were talking. And I really just was listening and just being with her, but I was struck by this image, right? And with her, her Christian faith and this and I said to her, I said, I'm reminded of Jesus on the cross when he cried out, my God, why have you forsaken me? Because she was wondering, where is God, in all of this. And that brought her some peace. She was able to connect, and she settled down and so forth. And she died then later that night. And her son, who was there, came in later after she had passed. And we were talking, and I was just offering him support. And he said to me, says, I'm so grateful that she was able to pass in peace, because she really was, And so I think about that and those kinds of stories and those ways of being with people. And even in really painful, difficult things, there's I don't know, a beauty, a freedom, a connection, something that happens that is really beyond words. I think that can be very, very powerful. I think of it, the idea that we're all just walking each other home. It's kind of that. I mean, that's all of us eventually, her in that experience, and how we can be there for each other in that and find peace even in that. So that story, it's one that has sat with me for years and years. And just the gratitude of her son that it was okay. The way it was okay.
I'm struck very powerfully by that image of you. As you said, you walk with people.
Mm-hmm.
And that ability to bear witness is so important at
Mm-hmm.
such a challenging time. But I can appreciate the imagery very much so, that sometimes
Mm-hmm.
people just need someone to walk with them
Mm-hmm.
so they're not alone,
Mm-hmm.
so that they can always hold on to the things that they've always held on to,
Mm-hmm.
which sometimes become very challenging at end of life.
Yeah, yeah, and that's what she was struggling with. She was feeling abandoned, feeling like, yeah, that's like, yeah, beautiful person. Oh,
Yeah. So one thing that you had mentioned as we got ready for today's podcast that you wanted to discuss is this idea of spirituality in healthcare. And I'd love for you to help our listeners understand, I guess, the role of spirituality in healthcare, or why spirituality is so important in healthcare.
yeah, it goes back to some of what I was saying earlier, just about addressing the needs of the whole person. Healthcare, as a science, and rightly so. I mean, it's good science. We've been able to do a lot of really very, very good, powerful things. You think about the technology and the skill, the gifts that our physicians and so many others have now, and the ways in which we're able to address the different diseases and things going on with the human body. But part of what that scientific mind does is it takes the human person and breaks them into parts, right? And so you have a cardiovascular system, you have a lymphatic system, and really sees the body as this collection of systems and organs and chemical processes and biochemical processes. You know what I'm saying?
Yeah.
And so it's easy to forget that that's like a person, like a living, breathing human being. And for us as healthcare providers to maybe get kind of caught up in just like fixing, and we're going to do everything we can do to prolong your life and so forth. So for example, everybody defaults to be in full code, right? We're going to do CPR, et cetera. spirituality is an invitation to begin to look at the values and the meaning and the whole person of what's going on, and to be in dialogue with them around their healthcare, and to be in conversation to be sure that we're doing things that make sense for them. I touched on just briefly that difference between healing and cure. Sometimes we default so hard towards cure that we end up, it becomes very kind of ugly, the end of life and so forth. And if we can embrace healing as different from cure, certainly cure, if we can cure, absolutely cure, but do that with a sense of healing. How are we promoting the health of the whole person?
Mhm.
Even, you think of hospice and so forth, right? As these movements around how do we help people who medically we can't really do anything more for in terms of cure, but how do we help them then to die well? How do we think of palliative care and so forth, and how do we walk with people through this journey, acknowledging that none of us is going to be here forever. All of us will eventually walk this journey. And how are we doing that in ways that bring meaning and hope, maybe reconciliation in relationships, or et cetera. So to me, that spiritual piece is really very important. And a big part in the role that I have now in working with administrators and leaders and so forth, and physician leaders and things, is to talk about that and to talk about their own spirituality. One of the big things we do at Bon Secours Mercy Health is invite all of our associates to bring their sense of spirit, their spirituality into the workplace, and to be working with our patients, from a place of spirit, right? That it's not just about, patient in 110, but it's about, Joe and his wife, right, who need our care, and really focusing on those kinds of things. And so how do people connect their nursing, for example, to a sense of calling from God, however they understand that, or a sense of, being part of a greater purpose or meaning. So to me, it's that is core to healthcare. I think about how our healthcare systems started historically in this country, oftentimes rising out of those different religious groups and folks who had this sort of deep faith and a desire to give compassionate care. And then from out of that, these medical systems have arisen. Yeah, to me, that's what it's about.
Thank you. So let's talk about healthcare practitioners a little bit. As you sit as a member of this kind of integrative team, you probably see a lot of the dynamics between doctors and other healthcare practitioners. But how can we all be better at collaborating with each other to support our cancer patients?
Well, I mean, I think conversation and communication is key, right? We need to be listening to one another. We need to be in conversation for the benefit of our patients. I think we need to, as much as we can, pay attention to the bigger picture. I think of, one of the things in training our chaplains, we talk about working with families where, a patient maybe is near end of life, and the kidney doctor comes in and says, hey, kidneys are great, and then leaves, but the cardiologist knows that, their heart is near failure and they're very near to end of life. We might need to make some decisions about life support and so forth. But all the family hears is that kidney doctor say, hey, the kidneys are great, right? And then they grab onto that hope, and rightfully so. I mean, we all want that, right? But it would be helpful, like if each of those specialists would, offer their perspective on their specialty, but also with a view to kind of the bigger picture of what's going on. That's where I think like palliative care and some of these other resources in the hospital can come in to help facilitate that conversation, and help people to understand, really what's going on, big picture. Chaplains do some of that work. I think sometimes physicians can use a lot of heady medical language that might go over people's heads, or just they don't understand it. So chaplains can help to translate sometimes. But to me, it comes down, bottom line, it's communication and really focusing in. The challenge, I think the barrier to that is the pace, right? It's like, gotta see, gotta go. And being short staffed and our healthcare systems being often overwhelmed makes that kind of like communication and measured, attentive pace difficult. Yeah, it's a tough problem. I don't have a silver bullet, but communication to me is like, it's all of it, I think. So it's a big part of it.
Yeah. And maybe just a little bit more time, as you said, can help us all do our best for that
Mhm.
person. right?
Mhm.
Which, as you had mentioned before, sometimes gets lost in this process of the outcome, whatever that outcome will be.
Mhm.
So, my last question is more about any experiences that you may have had or your patients may have had with massage therapy or aesthetic care in the realms that you've been working in, primarily oncology, but hands-on work in a level 1 trauma center is probably not the focus.
Right. Right.
But have you seen the impact of massage therapy with cancer patients in the arenas that you've worked in as a chaplain?
Yeah, when I was an oncology chaplain, we had a massage therapy program that they would come in. And I don't remember this; it's been a while ago, so I don't remember exactly the details. But I do remember some of the patients really expressing appreciation with that. I think it was sponsored through the Victory Center, which was it's a local advocacy group for some of these kinds of things for oncology. So I see a massage therapist every month. That's something I've been doing for, golly, probably 10 years now. Initially, as part of like sports massage and so forth, I was doing triathlons and things like that for a while, but have continued to do that just to work out the aches and pains and for my own self-care and health of my body. Yeah, so to me it is healing work. What's coming up for me right now is just I think about my own experience with massage is that sometimes it hurts.
Mm.
She'll get into a spot that's just like, ooh, working out a knot,
Uh,
and I, just kind of breathe through that, and I'm talking about like, deep tissue sports massage here. It's maybe a little different than what you're talking about, but man, when she's done, it feels so good, right? Because
mhm.
you worked the knot out. And to me, and again, this is spirituality is often on my mind that there's a metaphor there that oftentimes when we can sit and breathe, and loosen the knots in a sense, we get in these knots in our mind as we're,
Mhm.
when we get in these kind of habits of thought or habits of action. And so if we can breathe through that and be mindful and loosen the knots, that sometimes we find a deeper connection with ourselves and with our life, with others, with God.
Yeah, I've been always amazed at how, even when I work with a patient for 15 minutes, how they seem to just be able to be in this space of the unknown much easier.
Mhm.
Whether it's getting through chemotherapy infusion or just a really bad day or working with someone who's just been told some really stressful news, and somehow they can experience all of that a little bit easier because their body is not rigid or holding tension, and they can make space for that awareness that they now need to have.
Yeah, I agree. And you probably know more about this than I do, but that I think there's brain science behind that. I mean, there
Yes.
are studies that show that human touch is like we have to have it in order to release, certain chemicals for our brain and just for our health. And I think so often in our technological society and kind of the epidemic of loneliness that we're talking about recently, since COVID and so forth, how important that is, just that simple touch, and even just like a chair massage, somebody
Yeah.
just being on your shoulders for a little bit, how much good that can do for you.
Wow. Thank you so much, Daryl. It's been such a pleasure to talk to
Yeah, thank
you.
you.
I've learned a lot, and you give me a lot to think about, and I hope our listeners also are thinking more about some of the things you said. So again, thank you so much.
You're
We
welcome.
really appreciate your time.
You're welcome. Yeah, I'm glad to do it.
All right, collaborators, have a really great day, and I hope you enjoyed today's podcast.